I want to tell you a little bit about what does genetic medicine mean and why it's exciting and why it has such tremendous potential. Teach you maybe a little bit of science along the way, but excite you hopefully about the possibility of genetic medicine. The second thing I want to do is convince you of the role that it has to play, I think, in the future of global health. And third, talk to you about what I think you as leaders of governments around the world can do to help realize the full potential of this technology. As you heard, my name is Jeff Marazzo, and I had the privilege of being the founder and CEO of the first company to achieve a gene therapy approval in the United States and throughout many other countries now around the world in 2017. And I now today, having stepped away from Spark, chair the board or sit on the board of several companies working on gene editing, on cell therapy, on other gene therapies. And so this is a space that I know and have lived in for the last multiple decades. So, the potential of genetic medicines to transform disease. I want to start by telling you a little bit about what I think this offers us as a society. So, firstly, genetic medicine ultimately is about addressing disease at its root cause, about fixing the underlying basis of disease, not about ameliorating symptoms or putting a Band-Aid over things, but actually trying to fix the underlying root cause. And so that, in and of itself, creates tremendous potential. At the same time, this technology does face and create tremendous challenges for us as global healthcare systems. Governments not only must confront issues of accessibility, affordability, equity, but also institutional issues, logistics issues, and other financial challenges. And so as I walk through this presentation today, I will both walk through what I think those challenges are, as well as give you some suggestions and possible ideas to think about as policymakers and government leaders. First, I wouldn't be standing here personally talking about the prospects and the potential of gene therapy without the bravery of the people ultimately that were a part of really bringing these technologies forward, and that's the patients, the people that decide to sign up for cutting-edge clinical trials and ultimately be subjects in these studies and ultimately be the first patients in the world. And I wanted to introduce a few of them to you. You'll see Emily on the top left and Howard on the bottom left. They are both people that benefited from gene-modified cell therapies where cells, their immune cells in particular, were reprogrammed to fight their cancer. And today they're here because of that one-time curative cell therapy that they received. Andrew, in the middle of that page here, was a patient that received a one-time gene therapy for the treatment of his hemophilia, his blood clotting disorder, and he's now free from clots and infusions and the like that he otherwise would have treated himself with before. Kendrick on the far right is someone that was one of the first people in the world to receive a treatment for sickle cell disease. First ever gene therapy for sickle cell disease. Lucy is a baby that had spinal muscular atrophy, which is one of the leading causes of infant mortality, genetic leading causes of infant mortality, and she now has a totally different life as a result of gene therapy. And Cadicia was a patient that received actually the treatment that we worked on at Spark, Luxturna, for a very rare form of blindness, and where she's now able to have restored sight as a result of that treatment. So these are really, hopefully, if you leave with nothing else from this presentation, you leave with the pictures and the memories of these patients who have really, they were the real people jumping on the proverbial rocket ship and sort of taking off, and their bravery is something always to keep in mind. So quickly, I'll go through some basics here because I think it's helpful to understand and set the stage. Think of genes as life software. Essentially, the concept behind DNA is that they provide the blueprint for making proteins that ultimately keep us healthy and keep biological processes working correctly. And so you can think of genetic medicine as the ability to rewrite that code. The idea is that it acts at the DNA level and therefore allows for that corrected blueprint to make normal functional copies of proteins, as opposed to traditional medicines, which are typically try to act on proteins, but in a way that requires temporary that only works temporarily and therefore requires chronic treatment, repeated treatment over time. Whereas when you think about rewriting the blueprint, changing the code, you only need to do that once, and then you allow for the machinery of the cell to kind of figure out how to write from that code and produce proteins over and over again. So that's the basics behind when we say genetic medicine, what we mean. These are three types of genetic medicine. The first one is we call gene therapy, and it basically is the insertion of new DNA into cells that have a dysfunctional or incorrect copy of a gene. The second category and concept is called gene editing. In that case, we're actually changing existing DNA. We're not adding something in, but we're actually rewriting the specific code. And the last is what you'd call gene-modified cell therapy. I mentioned Emily and Howard received this. But basically, we reprogram cells. We take cells, reprogram them so they can fight various disease. And this has worked in particular in the area of cancer, but now is being explored in areas like autoimmune disease as well. This gives you a picture. So I was involved with Luxturna, which is the treatment referenced here on the far left. In 2017 was when it was approved in the United States. Subsequently, the next year or so, it was approved in Europe and so on and so forth. This should give you a picture of just how explosive this field it has already become. We are making tremendous progress just since that first year when there were the first 3 cell or gene therapies approved. We've now had 25 additional approvals over the course of the last 7 years. And you'll see at the bottom there's 46 more medicines that are under late-stage development or approaching the point where they're going to seek approval. So we're looking already, and I suspect over the next couple of years, we'll quickly get to that 100 mark where there's 100 of these treatments that are available to either insert a gene, change DNA, or add and modify a cell. So with all that as the promise around this technology, and the fact is that we can help millions of patients with a one-time curative treatment, what does it present in terms of challenges? Well, I think this picture gives you a clear image of the fact that we have a distance to go in terms of having an impact in terms of access to these treatments. But let me talk about a couple of the main challenges and then offer a few solutions, I think, on the next page. The first is that most healthcare systems are set up and have been set up to pay for more healthcare, more laboratory tests, more visits, but also more drugs or drugs that basically you have to take repeatedly for the rest of your life. So that is one of the fundamental problems that this technology introduces, which is what do we do when we now have a one-time curative treatment as opposed to a treatment you have to repeatedly take? The second challenge in this space is that the research and development investments today to develop these genetic medicines are particularly high. They're higher than any other class of therapeutic, and that has largely to do with the fact that there's still complex processes for making these, for discovering them, and I do think over time these will fall, but today they are high. The manufacturing costs themselves are high, and I just mentioned part of the reason for that. These are methods, whether it's a delivery method using what's called a viral vector, these are largely tailor-made and bespoke processes, and so sort of more industrialization is still what needs to happen ahead of ourselves. And then the sophistication is required within healthcare facilities. So many of these treatments today require that when they're delivered one time, you have to monitor patients and give them sometimes immunosuppressive agents. Sometimes you actually have to ablate their immune system before giving them a treatment. So the sophistication required today, and I think that's an important point, is non-trivial. And then there is complexity around supply chain. We got to know this well with the COVID vaccines and the requirement for -80 freezers. This is very typical for many of these treatments, as well as having to make the cell therapies in particular very close to where you take the cells out of the patient. So what does that mean? In my final minute, I will basically offer a couple of thoughts that I think you can consider as government leaders. First of all, I think it's critical to think about how we pay for these things and try to aim for paying for health, not for more healthcare. And so one of the things that we did as we launched our first treatment was propose that we get paid if and when the treatment works and if and when the treatment continues to work, that there's a performance element and that you propose, and that we propose to basically give rebates back or get paid over time based on performance. The second thing I would encourage is for healthcare systems to plan ahead and think about the fact that healthcare infrastructure that you might be building for a chronic medicine that has to be delivered over and over again is not perhaps the world that we're going to be in the very short order. And so I would think differently about the future of investments in healthcare facilities because of the fact that these medicines, as you just saw, there's already 27 of them, 46 more new ones coming. The last 2 points I would suggest is to support research and development. And you can do this in lots of ways. Of course, there is a large capital requirement to invest in these technologies, but you can also ensure access to clinical trials and enable the advancement of research and development by bringing your people and populations to have access to these treatments. And as well as investing in new technologies that will help us reduce the research and development costs and reduce the manufacturing costs. Those are critical areas. And then finally, I think it's important to think locally. Many of these diseases that these treatments can work on, some of them are more concentrated and present in certain countries, certain areas of the world. And so, with that, I will tell you that my strong belief is that the future of healthcare will be defined in large part by this technology and by genetic medicine. And hopefully I've given you some indications and ideas today of how you as government leaders can play a role in shaping that world. Thank you very much.